You are dispatched to a 60-year-old male who had chest pain and shortness of breath. He was mowing the lawn, and pain started about 20 minutes ago.
Okay. PPE, scene safety, number of patients is 1. Nature of illness would be chest pain and shortness of breath. I would request additional ALS ambulance, and I wouldn't rule out the need for C-spine right now. My general impression of the patient is that she's holding her chest tightly, saying her chest hurts. Hey, I'm Aaron, I'm EMT, I'm gonna help you out today. What seems to be the problem? She tells me that her chief complaint is shortness of breath, and so then I would give her an A and a V on the alertness level for alert and verbal, since she's talking to me, and then I'll move on to airway because she's and I would say open and patent because she's talking to me and telling me how she feels, but then I would also intervene with high flow oxygen at 15 liters per minute using a non-rebreather mask. And then moving on to breathing, I would check for equal chest rise and fall, telling her that I'm looking at the chest. And then I would move on to circulation, making sure there's no life-threatening bleeding anywhere. If so, I would control that first. Then I would check her pulses, making sure they're equal and bilateral. And then I would check her skin signs. And what are her skin signs?
Pale and diaphoretic.
Okay. And then what were you doing when this happened?
I was mowing the lawn.
Okay. Does anything make it better or worse?
Nothing does.
Nothing does? What does the pain feel like?
It feels like there's an elephant sitting on my chest.
Okay. Does the pain go anywhere?
It goes to my left arm and my jaw.
Okay. And on a scale of 1 to 10, 1 being the least amount of pain and 10 being the worst ever, what would you rate it at?
About a 7.
Okay. And you said you were mowing the lawn about 20 minutes ago?
Yes.
Okay. Do you happen to be allergic to anything?
Penicillin.
Are you taking anything right now?
There's a lot of medications in my bathroom, but the one I do remember is the nitroglycerin.
And have you taken that medication before?
I haven't.
You haven't? Okay. Do you go to the doctor for anything?
I had a heart attack about 2 years ago, and there was a stent placed.
Okay. Does this feel like the last heart attack you had?
Yes.
Okay. And what was the last thing you ate?
I had some burgers and some fries.
Okay. And the events leading to it, you said you were just mowing the lawn, correct?
Yeah.
Okay. Judging by my primary survey, I'll move on to my secondary survey, focusing on the cardiovascular system, making sure her lung sounds are good, making sure her pulse didn't rise with my intervention of the 15 liters of oxygen, and then I would ask for the vital signs. And the first one I would take would be the blood pressure. What's her blood pressure?
122/76.
Okay. And what's her pulse?
78.
And then her respiratory rate?
16.
And then I would also take her SpO2 if I had one. And then judging by her vital signs, along with my secondary and primary survey, I would make her priority patient, reassessing every 5 minutes and getting her out of here now.